Well, Dr John Paul Loughrey is Vice Chair of the Royal College of Emergency Medicine Scotland and works in A&E at a Glasgow hospital. Afternoon to you. I don't know what you make of that. Are you reassured by the fact that Hamza Youssef is having sleepless nights over this or not?
I think Mr Youssef probably shares the concerns of all of the members and fellows in emergency medicine and indeed all the staff who work in emergency care in Scotland, and that we're in a very difficult situation just now, have been for a very long time now, for many, many months, and we're going into a winter period where we know that the pressure in the system increases. So I think I share his concerns and I share his sleepless nights.
Yeah, and I suppose if you were to be less charitable or diplomatic about it, people who are working at the front end of the health service might say, well, you know, he might be having sleepless nights. They are literally having to deal with it on a daily basis.
Indeed, Tim, we see the pressure on the staff in emergency departments across Scotland and the staff absences, both short and long term, and difficulty retaining our senior members of staff, and in the difficulties we have every day when we go to work. We have long waits in emergency departments for beds, and as you know, that's what causes the pressure pushing out into the community, where we have long delays for ambulances to offload, and indeed people then experiencing long delays to receive an ambulance to bring them into hospital to receive the care that they require.
Tell us more then about the pressure on staff. You know, what are sickness rates like? You know, is a lot of that caused by simply workload?
It's a multifactorial absences, so we have no problem with recruiting staff to emergency medicine. We have a very attractive specialty that's rewarding and valuable, and people do enjoy their work, and we always have more people applying for jobs, both medical and nursing, than we have jobs available. We need to make sure that the conditions that we work in are suitable to retain the staff. Training doctors in emergency medicine takes a minimum of 6 years, and emergency medicine nurses are a very specialised and skilled group who provide intensive and enhanced care for those in the need in the first few hours of their illness or injury. The pressures just now are from having to look after those patients, but looking after many more patients who should have been moved downstream into inpatient settings a lot sooner in their journey, and we have patients waiting many hours, and indeed at times 24, 48 hours in bright, noisy departments in uncomfortable environments where there are more patients than there should be. So we have the combination of burned out staff of medical and nursing. We have a problem then retaining the staff that we have, and we have an issue this winter where we'll see staff absences through various illnesses compounded on top of all of the long-standing gaps that we have.
Yeah, it's interesting you say there's no problem recruiting people. It is retention. It's quite a sad state of affairs, isn't it, where the situation has got so bad that people literally can't stick it. And I suppose the worse retention gets, even worse for the people who remain.
Indeed, and that effect can be seen every day. So we have staff who, the ones that remain, the ones who aren't off at the moment, having to pick up the workload of other staff who are absent, and we have many departments running with 3, 4, 5 nurses short, with doctors short at times, and those who are left behind are the ones having to pick up the brunt of that. And that again then has the challenge of those staff taking on that extra workload in a high pressure environment. So the conditions that we work in are what we need to address in order to retain those staff. We need to make sure that the work is valuable, the work is rewarded appropriately in terms of time, and in terms of feeling that we are actually helping the people that we want to be able to help. It's a very difficult situation to come to work and to look after patients through the duration of your shift, and sometimes in some departments reporting coming back for the next shift and still having the same patients there, when actually our training is all about the first few hours, the first acute phase of an illness or injury, and then moving them on to the teams who are far better trained and placed to look after patients once they've progressed beyond those first few hours.
Is the health service at the moment being asked to do the impossible, or is there a way around this?
We have to make some brave choices and decisions in the health service over the coming weeks and months in order to try and mitigate the crisis in emergency care. Right now, all of the risk of this is being held within not just emergency departments, it's been held in acute assessment units, it's been held in primary care, it's been held in the ambulance service. A lot of that's at the front door of the hospital. That risk might be better shared across the whole system, and various places have tried with sharing that risk of moving patients to sometimes unconventional areas, but only after they've been seen, assessed and treated in emergency departments. So we have to make some difficult and brave decisions to try and mitigate some of those risks. we have to be honest with our patients and our public that what we expected of emergency departments and the experience even of just 4 or 5 years ago isn't the same as now. And if you come to an emergency department with a lower acuity or a more minor injury or illness, you might have a very long wait to be seen. But you will be seen.
In terms of being honest with patients, when patients see queues of ambulances outside waiting to drop people off, I mean, that's actually quite alarming, isn't it? Because normally you wouldn't have an ambulance unless it really was life-threatening.
It is, and we, previously we were used to turnaround times of under 15 minutes being the standard expected. And unfortunately now in many hospitals across Scotland we see ambulances waiting 3 or 4 hours to offload, and in small numbers of cases a lot longer than that too. So that's alarming. We do see patients who take their own discharge having waited in an ambulance for a period of time. Again, that's alarming. And we see the effect that this has on our colleagues in the pre-hospital environment, the paramedics and technicians who are used to being out and busy, who are now spending large chunks of their time sat outside emergency departments because of the crisis and the whole system, which starts with problems discharging patients from hospital when they're medically fit, pushing into high capacities in hospitals, which pushes into the emergency department. So the whole system needs to be addressed in order to try and resolve this very difficult issue.
Yeah, many challenges ahead. Well, thank you for speaking to us this lunchtime. That's Dr John Paul Loughrey, who's Vice Chair of the Royal College of Emergency Medicine.
New figures have revealed